Now, we're sorry for starting late. We've just had some technical issues, and I hope everybody can hear and see me all right. Um, I'm the host for today, and our webinar is on COVID-19, effects of pandemic on our mental health. First of all, I'm going to introduce myself to you. My name is Mariam Muritala. Good evening to those of you watching us from the United States. Good evening to those of you watching us from Europe and Africa. Good afternoon to those watching from the United States. And good morning to those watching from North America. AMDAF has brought to you a 4-day inspiring webinar to lift your spirits, emotions, and with wealth of information as to how we can all respond to this coronavirus, the COVID-19 pandemic. We have 4 speakers to discuss different topics hourly. Each day will take its course to one topic, and we're going to ask questions at the end of each discussion. First of all, I'm going to bring to you what AMDAF does and who we are. AMDAF. AMDAF is Amdala Africa Foundation. We at AMDAF, Amdala Africa Foundation, are passionate about contributing to the social, economic, and public awareness of African women. We aim to promote capacities for women of African descent in a way that they become empowered by engaging them in personal development activities that sought to give them voice in a striving way to eliminate root causes of discrimination. Coping with COVID-19 must have been challenging for majority of us, being it emotional, financial, physical, or economical, and so on. That is the reason why we have decided to put this 4-day program together in order to assist each other pull through this unprecedented time as positive as possible. Please feel free to share your comments, ask questions, and express your views about this webinar. I'll be introducing to you our first guest speaker of today, Mrs. Toyin Asaaju, a pediatric nurse from the United Kingdom. She will be talking to us today on your mental health. How does mental health affect us in this unprecedented time? Mrs. Asaaju is just joining us live now. Hello, Mrs. Asaaju, can you hear me?
Yes, I can hear you.
Good evening. We're sorry for joining in late. It's just some technical issues. Sometimes some of these things happens, but obviously, hopefully, we hope it's happened for a good reason.
Okay.
Right. Thanks for joining us and coming on board on this amazing webinar. And we just hope that the viewers find this very highly informative.
Mental is very important in our lives, and especially at this time, in this crisis, this pandemic, it's very important we all look after our mental health. And with the current situation, especially in the UK, over the last 3 to 4 weeks, we healthcare professionals have seen a huge rise in mental illness, new cases, and old cases that are gone into remission and have just come back because of the high threshold of stress and anxiety caused by the COVID-19, especially the coronavirus. So a lot of people are struggling mentally. And this is why
Certainly.
program is needed at this time.
Absolutely. I agree with you.
Um, Mental health is a very, very important aspect in the life of man. And as I shared on Facebook this morning, when I was trying to reach as many people to come on board and listen to this program, I was very emphatic in saying that the brain is an organ, just like any other organ in the body, and the brain needs to be looked after. But a lot of people often don't care so much about the brain because it's not um, an area of the body that you can physically see, especially because, if you have a broken leg, for instance, you can go to the hospital, you break your leg, you break bones, it can be fixed back. You have a cut on your finger, you see the blood, and then you immediately know you need to seek for help to repair it. But unfortunately, people don't pay so much attention to the brain because they can't really see the elements in the brain. But the brain can actually become overstretched and it can actually break down. It can be stressed so much whereby it causes a chemical imbalance and then it becomes dysfunctional. And immediately this pandemic started, I began to receive calls from people who did not even have underlying, mental health condition, saying, am I going to die? What's going to happen? Anxiety levels begin to rise. And the first thing that came to my mind is, oh my God, we need mental health awareness at this time because a lot of people are going to be affected mentally, and there's a lot of illness that is going to come out. Even amongst we healthcare practitioners, about a week into the pandemic, we heard about a colleague of ours who became so overwhelmed in the hospital, you know, looking after um, patients of COVID-19, and she ended up taking her own life. This was so, so emotional for me because I knew definitely a lot of people will be affected during this pandemic. A lot of new cases will come up. So this is why we need to sit down, sit back, you know, take the steering wheel of our mental health and focus mostly on the positive and not the negative. I'm just wondering if there's anything you'd say before I go on.
Yeah, I think as at this time, you are kind of like elaborating on the main discussion that we would be looking for. So I presume you're doing great. You can write on for now. Our questions will come in as you go further.
Yeah. It's about mental health, and I want you to know at this point in time, even though I'm so passionate about mental health, and most of the foundation work that I do, most of my work in mental health, you can actually see my backdrop right behind me. I'm very passionate about mental health because it's an area where my expertise lies, even though I'm not a mental health nurse. um, I'm a pediatric nurse, number one. Number two, I'm a senior public health practitioner. I'm a health visitor in maternal and women's health. But I run depression clinic, I run anxiety clinic. I look after people with postnatal depression and antenatally. But I began to really take um, mental health seriously because of myself and my first-hand experience. I've researched so much about it, and I know it's an area, especially in Black minority ethnic groups.
Absolutely.
Yeah.
Yeah.
It's an area
Yeah.
where we don't know so much about, or we don't
Yeah.
pay much attention to. And
I agree.
educate our people, we need to help them to look after their mental health. And it's something that I have seen in UK where I live and among the Black community. There's huge stigmatization on mental health issues, mental health illness. There's huge, you know, how would I call it? There's people are segregated, people are stigmatized, people are laughed at, and people are unnecessarily castigated and rebuffed when it's heard either in the family or in the community or in the church among the Black ethnic minority that somebody has got mental health illness. I am a lady evangelist in Christ Apostolic Church, and I am a pastor's wife. But today I sit here to tell you mental illness, it is not a spiritual illness.
Absolutely not.
It should not be completely dealt with as a spiritual,
Spiritual.
either in Islam, in Hindu,
Very true.
Christianity, in any religion.
True.
Mental illness is a condition of the brain. As prayers can help for the sufferer, the individual needs to seek medical help. Enough of castigating people who have mental illness and saying that it's witchcraft or it's a condition that maybe arrows were thrown at them from their forefathers or from their mother's house, from their husband's house, from their, you know, from anywhere and whenever. Stress leads to mental illness. When the brain is overstretched, it can
Stretched.
react.
Yeah.
So
Yeah.
I've seen enough and I've heard enough and I've seen people die or end up being sectioned in
Hmm.
mental health institutions. They were timid, they were scared of coming out to
Hmm.
talk because of the stigmatization, because they'll be bullied, because they'll be ostracized,
Yeah.
because they're being told in their home to keep quiet. They're being told you don't talk about it. We're Black people, we are Nigerians. Nobody must know that you are enough of this. And I'm tired of people being seen in church, being like notes and names, being beaten and to beat the devil out of them. Have in the olden days, in the early days of mental health illness, there's a popular quote among the children's nurses, the Victoria Cambridge, whereby she brought us from Africa to this country and that summer she had mental health illness and her auntie beat her to death, taking her to court no child died. Sad to tell you that even up till today,
Sorry
no
there, Mrs. Toyin.
is
Can I just come in there for a question, please?
within the black. Yeah, I'm listening.
Okay. Just when you said something about spiritual relation to mental health, can you please elaborate on that as regards our people, most especially from African descent, as you have said mentioned earlier, that people think when they have mental health that it can be spiritually healed or treated. Can you please elaborate on that? What are the signs to look for? How would you know if you have mental health, or how would you actually seek support in terms of treatment for mental health?
Yes,
Yes. Thank you.
signs out here in mental health. Mental health does mental health illness. There's so many different types. There's panic attacks, there's anxiety disorder, there's depression, there's psychosis, and psychosis comes in so many ways. There's psychosis that is induced by depression, whereby you suffer a high threshold of depression that drives you into psychosis. There's drug induced psychosis. I'm not going to go into that today. But in terms of the signs of mental health illness, it doesn't just come in a day, it happens gradually.
Sure.
Some signs that you will see, especially in women, research has taught us, evidence based research has taught us that more women tend to suffer mental health breakdown, mental illness, especially depression, anxiety, panic attacks, and thereby women tend to suffer it more than men because whether you are a housewife, whether you are a working class woman, whether you are, you know, a multinational banker or whatever, women wear different hats. The life of a woman is stressful, especially when you are a, a mother, a wife, and then you are juggling career at the same time. Naturally, life is stressful, but to now wear different hats as a mother, as a wife, as a career person, a lot of us fit into that role. Your
Agree.
stress threshold becomes higher. The signs that you
True.
first get when you are lapsing into either depression or a form of mental health illness, you begin to find it hard to cope. Things that you normally used to get under control, you begin to lose it. You just begin to see yourself uncoordinated for no
Hmm.
reason. You know,
Yeah.
you for me, at times when I notice I'm stressed, I might want to put a plate in the sink. I end up putting it inside the microwave or inside um my washing machine because I tell myself, Toyi, you need to calm down.
Oh, yes.
No. And my husband is very good in identifying when I'm getting
Yeah.
stressed. When I'm getting stressed, when as though um I'm not with it, he'll tell me, sweetheart, calm down, calm down.
Yeah.
And
It is good to learn to understand our level of stress so we know what to do to kind of like distress the situation. Yeah.
true. So when you feel that you're not coping with things that you ordinarily cope with, maybe domestic, or you find yourself unnecessarily irritable,
Mm.
or again a very very good indication that there's an onset of mental illness that
Yeah.
might that might come out as depressive episodes, or come out as anxiety.
Okay. Can
How
I just ask a question there?
to drop.
Yeah. You mentioned psychosis earlier.
Yes.
I just want to know, okay, what are the early signs of psychosis, and what can somebody do to like have an early intervention when it comes to that? Because sometimes people think, oh, okay, it's just a situation, or probably it's just because of their workload or something. Or some people think that they can actually deal with stress, that they have some coping mechanisms that they use, but not knowing that they do not actually realize the level of stress that their body has actually been contained in. So, and like, how do we know the early signs of psychosis? Because sometimes people are stressed and all that, but how do they know that, okay, this is a sign of psychosis, this is a sign of depression, or this is a sign of me, like I could get a panic attack sooner or later?
Thank you very much, because would I would actually pick two areas. Unfortunately, a lot of people do not know the signs, the triggers,
Yeah,
until they actually become victims.
absolutely.
After you become a victim or
Hmm.
you pass through it, then you will sit back after recovery. You will
Yeah,
sit back and say, you know what? I don't want to be in that dark tunnel I've been before. What
absolutely.
are my triggers? What are the signs? What happens to my body? What happens to me when I'm sleeping? You start to work out for indicators. And some of the things that could actually, psychosis is normally the heightened level of depression. You go into depression before you go into psychosis. You can't just wake up one day and get into you know, you get into the state of psychosis. A lot of stages would have happened. The first thing is very high threshold of stress, lack of ability to cope. You become slightly disoriented. Maybe it could happen like 1 or 2 hours in the day, or even
Sorry, excuse me, Mrs. Asaaju. Just a second. Sorry for disrupting you. I don't mean to disrupt you, but you're not quite clear when you're speaking. I think there's a volume intercepting when you speak. Maybe if you want to reduce the volume of something, maybe around you that is intercepting your audio, because it's not coming out clear enough for us.
okay, can you hear me?
Maybe if you speak again.
Can you hear me now?
Yeah, clearly. Thank you. Clearly.
Okay,
Yeah.
okay. So as I was saying, um, in terms of psychosis, as you mentioned, it's a gradual thing before you get to that really, really high stress level that causes complete breakdown or a complete meltdown. Your body would have been giving you signs, warning signs
Yeah.
or um, activity signs, like I said, inability to cope. And it's a lot of emotions are combined. For someone like you that is normally very strong, you see yourself just becoming tearful unnecessarily,
Hmm.
break down, you cry over things that you shouldn't cry about. You become irritable. And when you've never had that episode before and you start to have it, you still think that you are strong, you are coping. But what makes one crazy and reach the level of psychosis is when you do not go for help, or if you are trying to seek for help and people begin to undermine you or begin to tell you, oh, there's nothing there. Oh, there's nothing there. Oh, there's nothing there, you know, and they're not listening to you. But unfortunately, within the Black ethnic minority, a lot of us are not listened to. A
Hmm.
lot of men are not listened to. A lot of children are not listened to.
Absolutely.
The men, a lot of men, when they are suffering mental illness, they
Wow.
don't come out. It's at the tail end when it's too late. A lot of them don't come out because of male ego, or they'll be seen lesser than a man. That's why they don't seek help. But women are quick to say, "Ah, I don't know what's happening to me. I don't know what's happening to
Very
me."
true. Very true.
If you are not in a good support network,
Mm.
by they can help you to access health care and correct, the chemical imbalance in the brain,
Yeah.
where God say, come to church, sit in church for days, pray, come to the mosque, come to the Hindu temple, come to wherever your faith is. Don't get me wrong, being a person of faith can help, but that's not all. We need to stop stigmatizing people. We need to stop ostracizing them. We need to stop downplaying mental health. If
Sorry, Mrs. Asaaju, can I just come in there? Because I think by now people will kind of like have a glimpse of or insight to what mental health is and how it can have effects on them. But can we just talk about the effects of COVID-19, the coronavirus, on mental health? How has it affected people? Has it affected us, people around you, people like that has consulted you, or people around us really? And what are the things that we can do to actually manage coping with COVID-19 and the stay at home thing?
honestly, let me drop it back to 19 and coronavirus pandemic. If I say, even I that is sitting right in front of you and chatting with you, if I say I'm not affected, I'm 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 not being truthful.
Yeah.
Human beings we are, we're social beings. We
Yeah.
love to interact. We love to go
Yeah.
out,
Yeah.
especially we black people. We don't joke with
Hmm.
our dressing up, Owambe parties, you know, our socialization skills. Mind
Yeah.
you, a lot of us who live in diaspora, especially overseas in Canada, in UK, in Ireland, in the US, most of the things we use to relieve high stress level and falling victims of mental health illness is the power of social gathering, social association. Unfortunately, that has been taken away from us. So this is a time whereby, we're housebound, we're on a lockdown, which is not our
Absolutely.
own. But how to make our mental health survive during that lockdown that we are is very important. Thank God
Absolutely.
for the kind of phones that we have today. Someone posted last week on on a group chat that I was in that, oh my goodness, if we had the kind of big phone that we used to have before and we couldn't see each other, we couldn't interact, it would have been worse than it is. The power of positivity at this time of this lockdown is very important. One of the strategies I use, which has been beneficial to me, which I want to share today, is standing in front of my mirror and
Mm.
telling myself, Toyin, it will all come to, it will all pass. It will all pass. It would come to an end. I thank
Mhm.
myself on a daily basis, even as a healthcare practitioner, a frontline staff that still has to work every day
Yeah.
and my clients, see my clients, and go out there. I start my day with positivity. I listen to music, I dance, then I eat, I
Yeah.
exercise. Government in the UK has given us at least one exercise per household. I prefer to do my exercise myself. I put on my earphones, I
Very
walk,
good.
I wear my mask, go out and walk. It clears my head. And also, a very good friend of mine. started a Facebook interactive program, which is also like webinar on Zoom. Every week, we choose a very positive movie that we
Hmm.
all watch on Netflix, on Amazon. We watch it,
Very good.
and then we come together and talk about it. We motivate ourselves. I am writing a book, you know, about mental health. It
Good.
cannot be a better time to
Oh,
write a
absolutely. I agree with you.
book on mental health, which will be coming out by the end of the year. I've weaved some of the factors and events of COVID-19 into it so
Yeah,
that people can identify and see that mental health illness is real and
absolutely.
talked about. People should be free to seek help. People should be free to say, you know what, I had
Uh,
depression time ago.
can I come in there for a second? So when you mentioned like dealing with COVID-19, you said something about having a self belief, like dealing with it individually, like being positive and all that. Can you please elaborate more on how people, because you know we're different. You said you do some exercise, you do positive stuff, you dance, you can watch movie and all that. Can you please, like, sometimes when we talk about all these things, some people don't see it the way you've talked about it. Just kind of like put it in a like simple steps, like how the procedure on how to actually do what you've just said and how to enhance our self determination in terms of dealing with this pandemic.
One of the critical ways, which I can also say I've been a victim at the beginning of the pandemic, because it came as a root shock. Nobody
Absolutely.
warned.
Oh,
Came
yeah.
as we were not expecting it.
Yeah.
One of the things that could have affected my mental health and caved me in is negative news on
Yeah.
social media,
Good.
on daily news,
Yeah.
CNN, Al Jazeera. The world already had so much bad news as it
Absolutely.
was. Newspaper is filled with bad news. The internet is filled with bad news. Social media
Absolutely.
everywhere
I
is
agree.
bad news.
I
You
agree with you.
never know until you fall a victim the
Mm-hmm.
effect that negative news can have on you. You can actually listen to it or watch it, go to bed, and actually have horrible dreams based of what you have allowed into your system. Please don't get me wrong. Information is power. Without information, we cannot survive.
Yeah.
But what you now decide to do with the information that you have,
Yeah.
you can let it either affect you positively or affect you negatively.
Yeah.
The
True.
pandemic has told us that a lot of people are going to die globally. Yes,
Yeah.
I've heard, fine.
It's a real fact.
What precautions am I going to take
Think.
for it
Essential.
to affect my mental health? For me not to wake up every day and start becoming emotional and crying
Yeah.
that people are dying around me. That
Sad.
is so. One thing is to listen to the information.
Mm.
Another thing is to take that information, listen to it, but don't let it affect you in
True.
an adverse way.
It's very
It is
important.
positivity. And that's where I say spirituality comes in. Faith helps. A lot of us that are people of faith, Muslims, Christians, Hindus, whatever religion you belong to, we draw strength from one another. There's a
Mm.
lot of prayer groups going around on the internet, you
Yeah.
know, people praying about it. There are people raising hope. I have a prayer group that I joined too. And at a point in time, I was not getting blessed anymore
Mm.
because what was being shared was adding more fear into people instead of raising hope.
Yeah.
We need
Yeah.
hope at this time.
Yeah.
We don't need self gratification. We don't need, people to come and show their power or their ego. We just all need to humble ourselves
True.
under the pandemic and make ourselves raise hope for one another. This
Mm.
is the time for me to hold my sister, hold my brother's hand, and say, what? You are weak at this time. Draw strength from me. I am weak at this time. I'm drawing strength for you. Even if you
Mm.
are drawing strength from your children, anybody can be weak at any point in time, and you don't know how far that strength you are drawing from your neighbor, from your husband, from your children, from your church network, your mosque network, your religious network, even your career network, your colleagues at work network. You don't know how it can affect your mental health positively. So it's a time to be more positive than negative. It's a
Absolutely.
if you are the type that survives being on a routine, go for it. I, for one, I know that if I don't wake up as if I'm going to work, have my bath at 7 a.m., my dear sister, I don't think I will bath before I go to bed. So I discipline myself
Yeah.
to have a routine. And you know what? That routine does great for my mental health.
Mm.
At the
Yeah.
beginning, when I go to exercise one day, this, that, I fell short. For like 2 weeks, I didn't come out of my house to exercise. I had to tell my husband that if you can literally push me out of the house to go, it's not easy. I'm a
It's
big,
not easy. So what you're saying in essence there, Mrs. Asaaju,
yeah,
what you're saying in essence there is we just need to have a self drive to be able to do something to combat the negative effects of COVID-19 on individuals, right?
fantastic. Honestly, you just hit the nail on the head. Self motivation, self drive, self, self goal.
Yeah.
Tell yourself, be positive. I can
Yeah.
do it. I
Very
can make
important.
I can
Positivity
make
you mentioned there is highly important.
exactly. Please, please. If you are motivating yourself and you fall by the wayside, don't dwell on it.
Mm.
Pick yourself up again and say,
Absolutely.
even though I've fallen today or I've fallen tomorrow,
Mm.
I can still get up
Yeah.
and go on. The
Yeah.
race, not, for the weak, is for the strong. And who's going to beat you blue and black?
Yeah.
If today you decide you don't want to shower and you go to bed smelling on your bed, but tomorrow you wake up, you dust yourself up. Even me that I'm talking to you, I can't remember the last time I wore makeup.
Yeah.
Do a lot. I don't do Facebook program because there's a lot of effort to get.
I agree with you.
I gave myself a pat on the shoulder, and I've done it.
I
If
know.
the sister can motivate me to come and do,
Absolutely.
and I got myself dressed, and I was waiting for 7 o'clock, dusted, went through my notes, and you know, I've done it, and it
Yeah.
has been good for my mental health.
Now, Mrs. Ashaju, I just want to bring to your awareness that we have the last 10 minutes on the show.
Okay,
If you have some vital information that you just want to put out there to people, because we're going to be welcoming questions in a moment. We're hoping to get more questions anyway. I still have a few questions here, but if you kind of like want to round up a bit on the highlights of today, maybe that will be beneficial to us.
the highlight that stuck out, which would always stick out for me, is my black ethnic minority. the Black minority ethnic group in diaspora in Africa, and the stigmatization behind mental health illness. We need to stop stigmatizing people, castigating them,
Mm.
ostracizing them, and making people who have either gone through mental health illness or are going through it,
Yeah.
need to stop making them feel that there is no help out there.
Mm. Sure.
It's illness, just like anybody can have malaria or even flu. The brain does get tired.
Mm.
Don't use someone's weakness to rob them of their joy. I believe for someone to come out and say, I'm going through mental health problems and I
Mm.
need help, I need to be signposted to where I can access help, to
Mm.
get education, to get, whatever form of input. It's not a weakness, it's a strength for someone to approach you and say, please help me so that I can get better.
Right.
Time for you to go to A, B, and C and say, do you know so person? Do you know so person? She's gone mad.
Mm.
She's lost it. We're very good at doing that. And that's why people don't seek help until they end up in psychiatric hospital.
Okay, can I just come in there, Mrs. Asaaju? I just want to ask you about routine. When you mentioned routine earlier, I just want you to kind of expatiate on that for people that might not have routine or might find interest in routine.
Yeah. Routine is hard. I told you. So there's nothing to shy away from. But over the years, because I'm dyslexic and I'm not shy to say it, even though I'm dyslexic, I graduated with a first class honors and
Wow, congratulations.
distinction as
Wow,
a public health nurse. So
congratulations.
I might be dyslexic, but I still do well.
Absolutely.
I have areas where I still struggle, you know,
Mm.
and I always flag it up to people. I'm dyslexic. Don't
Mm.
bombard. For me, what has helped me in my routine and my daily life, because I'm a wife, I'm a mother, I'm a nurse, I'm a pastor's wife, I have a ministry, I run an NGO, I work with
Wow,
different hats.
wow,
I live my life by a notepad.
wow,
If you look at my wardrobe, I have sticker notes everywhere. On my
wow.
wall, sticker notes. I believe that the faintest of ink is better than the sharpest of brain. I write
Absolutely.
down,
I agree.
tidy up my, my house. I
Mm.
write it. If I want to cook soup, I write it down. I never, because it's my survival mechanism. What works for me might not work for another person. I told you, if I don't wake up to have my bath, even if I'm working from home, trust me, that day might be totally useless and I won't achieve anything.
Right.
But at the end of it, even if I wake up and decide to have my bath and I let the day be useless, I don't dwell on it
Mm.
because it dig a hole for me. I say,
Yeah.
well, so it didn't go as planned, but there's still another day you can pick up.
So my other question is positivity. You know, sometimes, like just you mentioned earlier, that some people struggle when it comes to being positive, but we are very different as individuals,
Yeah,
and some people have very low self esteem. Mental health will then become a huge thing for them. Because for somebody that has low self esteem to mention something about mental health,
yeah,
it is like it's going to be a big deal.
Yeah.
to them. How can we boost our optimism? Like, how can somebody be positive as an individual?
Thank you so much for what you have said, because it actually brought down memory lane for myself. As bright as I look and as posh as you can call it, that I've about myself, I didn't get there in a day,
That's it.
and I'm still a work in progress. So, help to my sisters out there that have some form of low esteem or are emotional over everything. I've been there. I've had my battles. I've had my own dark tunnel. And you know, one of the things that really helped me and would help a lot of people out there, surround yourself with people that believe in you. Surround yourself with people that not necessarily you can trust, but people that can give you a shoulder to lean on. Yes, there are a lot of women, as I told you, women suffer these things more.
Mm,
Some of them have husbands that have battered them.
mm,
Some of them are still inside domestic violence, which causes serious mental health illness. Some of them, have their kids who have turned against them. Some of them is financial crisis. Women battle a lot. Some of them is even health issues that are not mental health. Some people grew up with parents that have never seen the good in them. They've been battered, they've been talked down on, they've been
mm.
told never do well.
Just a minute, Mrs. Asaaju. I have a question from the audience just before we finish because we literally have 2 minutes left. So
Okay.
the question from the audience is, what advice would you give to a caregiver who looks after a mental health patient with regards to social distancing not to be misinterpreted as a negative body language?
Oh, honestly, can't. That is a tough one, because I myself, I told you I'm a frontline staff. I still go and see my clients. I go into their home, and with this right now, I people who work in mental health environment, it's really a lot, because they do a lot of restraining, they do a lot of physical contact, they have clients, they have patients who even, kind of become physical with them, and try to restrain someone in this COVID-19 period that we find ourselves, and the transfer of coronavirus, and catching it here and there. It's really, really hard, because at the same time, this caregiver, this mental health worker who risk all, might have children at home, might have husband at home, might have wife at home, and you go there to contribute your quota to the healthcare, frontline um, workforce, to help people in this time of pandemic. Your worry is, will I catch it? Will I not catch it?
Hmm,
It's not dangerous, but the other thing for us, personal
sorry.
protective equipment. We have the gowns for those who are in clinical setting. We have the mask. We have the gloves and things like that. I'm sure in their own organization, there must be a policy for them that they can follow. You know, I won't say don't follow the policy um, of your organization or your hospital. The policy is what you adhere to, and I mean, if it's something that you feel might affect your safety, you might want to come out and talk about it, especially if it's not in line with the policy that you are supposed to work with. I've heard, I've read, and I've seen healthcare professionals who refuse to care for people in this time of COVID-19 because they are not given the tools, the PPE that they need. So, with things like that, there are policies in place that will help all of us. I go and see my patient gowned up, wearing my gloves, putting my face mask, and before I go into any home, I have a checklist that I need to do. And if there are coughs, if there are, someone who's had a temperature in the last 24 hours and things like that, my office has put out a policy out there, and it's left for me to adhere to that policy and make use of it, when I'm going to provide health care for anyone.
Um, the last thing yeah, thank you for that. The last thing I have here is just to round up the show, my herbal drinks, because I believe in a lot of herbs. And each time I go, before I go out, sometimes in the morning, and when I come back, maybe in the evening or at night or in the morning, whenever I come back from work, what I do is because I'm an essential worker as well. I'm a frontline staff too, and I'm in the social work department. So, and I love to drink my herbal drinks because when you have contact with so many people, you just never can say. You mightn't have the signs and symptoms of COVID-19. However, that doesn't leave you out of the question or out of the whole, pandemic thing. So what I kind of like protect myself with is the herbal drink. So what can you talk to us about that? I know it's kind of like it mightn't come from a medical perspective or practice, but I just thought, as some sort of preventative measures, what are the things you can advise people on? Because we have like, I say literally 2 minutes left because I've given us like a 5 minutes grace on this.
For me, as you said, I share the same views with you. I can't lie. I share you in the sense that I love my herbal drinks as well. And I'm actually a promoter of herbal wellness because I'm a long reach rep, and I believe so much in my herbs, my herbal tea, my turmeric, my ginger. I eat raw ginger. I've done it before COVID-19. I still do it. And whatever I believe in, I go after. Whatever I use or I take and I see it improve my health, I go after. I work in the healthcare sector. I know that the orthodox medicine is good and it does, cure. It provides cure to illness. And I love, as you get older, especially once you hit the age of 40, your body is like a car. You need to do MOT, you know, you need to do checks. The older you get, the more health challenges. So, and I think that's where places like Holland and Barrett, Longreach, a lot of these herbal remedies and things like that. I live abroad in UK, but I don't joke with my agbo. I love to drink agbo. I
Sorry,
bought
can I just come in there? We have the last few seconds on the show. Do you have one or two things to say before the end of the show, before I round up?
the only thing I have to say is this is a time more than ever for every one of us to remember that mental illness is real. Mental health is important. The brain is important. What you feed it, especially at the time of this pandemic, is very, very important. You feed it negativity, you get negativity. You feed it positivity, you get positivity. We are all in charge of our mental health. Let us look after it so that after this pandemic, we will come out finer, more beautiful than we were before. God bless us all.
Thanks, Mrs. Asaaju. It, in fact, has been such a wonderful and a tremendous evening with you. We appreciate you, and may God bless you. And which brings us to the end of today's talk show. Thank you, everybody, for joining us on today's webinar. We surely look forward to seeing you tomorrow by God's grace. Do have a blessed and a pleasant night. Goodbye.
God bless you.
Thank you.